Welcome to Why Get a Flu Vaccine? What Every Patient Should Know, a Centers for Disease Control and Prevention program broadcasted on MedLive. I'm Dr. Mark Tenforty, an Epidemic Intelligence Service Officer in the Influenza Division at the National Center for Immunization and Respiratory Disease of the Centers for Disease Control and Prevention. It's my pleasure to talk to you today about influenza and flu vaccination. We'd like to hear from you during the program, so if you have questions, just type them into the box below at any time during the discussion. Please keep in mind that the questions should be general in nature, and we are unable to answer questions about your case specifically, but we encourage you to bring those questions to your doctor. First, I'll give you some general background about influenza or flu, how it causes illness, and how your body responds to flu. Flu is a contagious respiratory illness caused by flu viruses. Each year in the United States, seasonal flu epidemics occur, generally during the fall and winter seasons. When people infected with flu cough or sneeze, you can inhale droplets that contain the virus. The virus then infects cells in your body and makes copies of itself. This infection triggers inflammation in your body, which is responsible for flu symptoms. Common symptoms from the flu include fever or feeling feverish, chills, runny nose and congestion, cough, muscle aches, headaches, and fatigue. Some people may have nausea and diarrhea, but this is more common in children than it is in adults. Severe inflammation from flu can cause damage to your lungs as well as other complications. Your body's immune system responds to flu by creating proteins called antibodies to fight the infection. Next, we'll discuss the benefits of getting vaccinated against flu. The benefits of vaccination are really threefold. The vaccine reduces the risk of getting sick from flu. It may reduce the severity of flu illness if you do become sick, and it helps prevent spread of flu from person to person. The CDC recommends annual flu vaccination in most people who are 6 months of age and older. As the exact timing of the flu season can change from year to year, vaccination is recommended by the end of October. However, if you haven't gotten your flu vaccine yet, it's not too late, and you should still get vaccinated now. Most people with flu will recover within a few days to less than 2 weeks. Flu can make people feel very sick and is a major cause of missed school and work in the United States. Some people will also go on to develop more severe complications as a result of flu, some of which can be life-threatening or even result in death. Common flu-related complications include sinus or ear infections, as well as infections in the lung or pneumonia. Flu can cause inflammation of the organs, including the heart, the brain, and the muscle tissue. In people with chronic health conditions, such as asthma, diabetes, or heart disease, flu may lead to a worsening of those conditions, even if they're well controlled. In some cases, flu can lead to multi-organ failure, sepsis, and it can even result in death. Flu vaccine causes the body to produce proteins called antibodies that protect against flu. These antibodies develop within about 2 weeks of receiving a flu vaccine. Because of the long process of developing and making vaccines, flu vaccine planning begins many months before the upcoming flu season. Flu vaccine is made to protect against the 3 or 4 types of flu viruses that research indicates will be the most common during the upcoming season. There's very strong evidence over several decades that a flu vaccine prevents against flu-related illness. Each year, flu vaccine prevents millions of illnesses, tens of thousands of hospitalizations, and thousands of deaths in the United States. Vaccine effectiveness differs from year to year, but on average, vaccination reduces your risk of going to the doctor for flu by about 40 to 60%. So thank you to our audience for submitting your questions. Please continue to send them in. Before we get to some of these questions, let's take a quick poll. How long after vaccination does it take for antibodies to develop in your body that provide protection against flu? The options are A, 1 day, B, 2 weeks, C, 3 to 4 hours, or D, 1 month. While we wait for your responses to come in, here is one of our audience questions. Where can I get a flu vaccine? Flu vaccines are offered in many doctor's offices, clinics, health departments, pharmacies, and college health centers, as well as by many employers and even in some schools. Even if you don't have a normal or regular doctor or nurse, you can get a flu vaccine somewhere else, like a health department, pharmacy, urgent care clinic, or even at your school, college health center, or workplace. There's an online tool that can help locate a flu vaccine near you. Simply visit vaccinefinder.org, enter your zip code, and select flu to locate flu vaccine available within your area. Now let's answer the poll question. The correct answer is B, 2 weeks. Since it takes about 2 weeks after vaccination for antibodies to develop in the body and provide protection against flu, the CDC recommends that people get a flu vaccine before the flu starts spreading within your community. Getting vaccinated later, however, can still be beneficial, and vaccination should continue throughout the flu season, even into January or later. The benefit of getting a flu vaccine goes beyond preventing flu illness. If you get vaccinated, but you still go on to get flu illness, a vaccine may help to reduce the severity of your illness. In adults, flu vaccination reduces the risk of being hospitalized for flu by about 40%. A recent study from the CDC found that in adults hospitalized with flu, vaccination reduced the risk of requiring intensive care unit or ICU admission by almost 40%. In the same study, vaccination also reduced the risk of dying in the hospital by about 50 to 80% across different age groups. Although everyone 6 months and older should get vaccinated yearly against flu, vaccination is especially important in certain groups who are at high risk for developing complications from flu. One of these groups is older adults. Most flu illness occurs in people who are 65 years of age and older. In recent years, 50 to 70% of flu-related hospitalizations occurred within this age group. Additionally, 70 to 85% of deaths occur in this group. A flu vaccine has been shown to reduce the risk of flu-related hospitalizations among older adults by an average of 40% during recent flu seasons. In addition to older adults, flu vaccination is also very important in people with certain underlying health conditions. These conditions include asthma and other chronic respiratory diseases, heart disease, certain neurological conditions, diabetes and other metabolic conditions, and conditions that weaken the immune system, such as cancer. Chronic medical conditions are very common in adults. More than 30% of people in the U.S. who are 50 to 64 years of age have at least one chronic medical condition that puts them at high risk for developing complications from severe flu. Importantly, flu can make health conditions like asthma, heart disease, and diabetes worsen, even if these conditions are well managed. For example, people with asthma have chronic inflammation in their airways, and flu infection can make asthma symptoms worsen or even trigger an asthma attack. The risk of having a heart attack is about 6 times higher within a week of lab-confirmed influenza or flu infection compared to other times. Additionally, about 30% of adult flu hospitalizations reported to the CDC have diabetes, compared to about 9% of the overall adult population. And this highlights that people living with diabetes can often develop severe influenza or flu. Flu vaccination can prevent complications associated with asthma, diabetes, heart disease, and other chronic medical conditions. For example, vaccination has been associated with a lower risk of cardiac events, such as heart attacks, in people with chronic heart disease. Vaccination is also associated with a reduction in the risk of hospitalizations from flu and diabetes events by nearly 80% in people living with diabetes. Yearly flu vaccination is recommended by the American Heart Association, the American Diabetes Association, and the American Lung Association. A flu vaccine helps to protect pregnant women during their pregnancy as well. Flu vaccination helps prevent against adverse pregnancy outcomes and acts to protect the baby through the first few months of life. Pregnancy causes changes in a woman's body, including changes in the immune system, the heart, and in the lungs. These changes make pregnant women more prone to getting flu, as well as to having severe illness. In fact, pregnant women are twice as likely to be hospitalized from flu compared to women who are not pregnant. Flu illness in the mother may also harm the developing baby. For example, a common flu symptom is fever, which has been associated with neural tube defects and other adverse outcomes for a developing baby. Vaccination against flu helps protect both the mother during the pregnancy and the baby after birth. Vaccination reduces the risk of flu illness in pregnant women by about 50%. It also reduces the risk of being hospitalized with flu by about 40%. Babies younger than 6 months old are at the highest risk among all children for developing flu-related hospitalization. Antibodies created by the mother after vaccination are passed on to the baby during the pregnancy. Flu vaccination during the pregnancy can therefore protect the baby from flu infection for several months after birth when they are not old enough to be vaccinated themselves. And what about older children? Flu vaccination can also be life-saving for children 6 months and older. Each year, millions of children get sick with seasonal flu, thousands are hospitalized, and tragically, some children even die from flu. Flu can cause a serious illness even in healthy children, with about half of children who die from flu in recent years having no major medical conditions. Since 2010, flu-related hospitalizations in children less than 5 years have ranged from about 7,000 to 26,000 in the United States. About 80% of children who die from flu-related illness are not vaccinated against flu. Flu vaccination may reduce the severity of flu illness if a child does get sick. It has also been shown to reduce the risk of being hospitalized for flu, requiring admission to the Pediatric Intensive Care Unit, or PICU, and of dying from flu. Vaccination has been shown to reduce a child's risk of flu-related PICU admissions by over 70% and to reduce a child's risk of dying from flu by half. So let's pause again for our last polling question. Select the answer that you think is correct. The question is, which of the following is an important reason for everyone 6 months and older to get an annual flu vaccine? The options are A, flu vaccination can be life-saving in children. B, flu vaccination can keep you from getting sick with flu. C, flu vaccination can prevent certain chronic health conditions from getting worse. Or D, all of the above. While we wait for those responses to come in, here's another great question from the audience. Does the flu vaccine prevent someone from getting flu 100% of the time? While vaccine effectiveness can vary, recent studies show that flu vaccination reduces the risk of going to the doctor for flu by about 40 to 60% overall. As we've covered in this presentation, there are many reasons to get a flu vaccine each year. Benefits include reducing the risk of flu illness and reducing the risk of hospitalization and even flu-related death if you do get sick. Now let's answer the poll question. The correct answer is D, all of the above. Flu vaccination has several benefits beyond reducing the risk of flu illness, including reducing the risk of death in children by half and preventing serious complications from flu in people with certain chronic health conditions. So hopefully I've convinced you that getting a yearly flu vaccine has direct health benefits for you. These benefits include prevention of flu-related illness, as well as a reduction in the severity of illness in those who do become infected with seasonal flu. Remember that flu is a contagious disease, so it can spread from person to person through sneezing and coughing. So another benefit of vaccination is that by protecting yourself against flu, you may also reduce the risk of infection in those who are around you, such as your loved ones. Flu vaccination may decrease spread in your household as well as in the community, including in those who are more vulnerable to serious flu infection. As we discussed earlier, these groups include babies and young children, older people, pregnant women, and people with certain chronic health conditions such as diabetes and heart disease. To wrap up, I'd like to briefly discuss some common misconceptions about the flu vaccine. A common misconception about flu vaccine is that the vaccine itself causes flu. So flu shots are currently made in two ways. One way is with flu viruses that have been inactivated or killed and are therefore not contagious to you. A second way that flu shots are made is by using a single gene or segment from a flu virus in order to produce an immune response without actually causing infection. Side effects of flu vaccine are generally mild and short-lasting. Common side effects from a flu shot can include soreness, redness, or swelling where the shot was given, or short-lasting symptoms such as low-grade headache, fever, nausea, muscle aches, or fatigue. These side effects are sometimes mistaken for having gotten the flu from the vaccine when that's not the case. There are several reasons why someone might get flu symptoms even after they've been vaccinated against flu. Some people can become ill from other respiratory viruses besides flu, such as the common cold. These viruses can cause symptoms similar to flu and also spread and cause illness during the flu season. It's possible to be exposed to flu shortly before getting vaccinated or within that 2-week period after vaccination that it takes the body to develop immune protection. This exposure may result in a person becoming ill with flu before protection from the vaccine takes effect. A person may have also been exposed to a flu virus that is very different from the viruses that vaccine is designed to protect against. So while flu vaccines protect against the viruses that research shows will be the most common during a season, there are several different types of flu viruses that can cause illness. Flu vaccine can vary in how well it works, and some people who get vaccinated may still get sick. In summary, it's not too late to get vaccinated if you haven't already. Vaccination can still be beneficial as long as flu viruses are circulating, even into January or later. Finally, flu can be unpredictable and seasons can vary. Seasonal flu disease usually peaks around December and March most years, but disease can occur as late as May. That concludes the presentation I have for you today. Now let's take a few more of your questions. So, when should you avoid getting a flu shot? People who should not get a flu shot include children who are younger than 6 months of age, as they are too young to get a flu shot, as well as people with severe, life-threatening allergies to flu vaccine or any ingredient that's in the vaccine. There are also some people who should speak with their healthcare provider before getting a flu shot. If you have one of the following conditions, you should talk to your healthcare provider, and they can decide whether vaccination is right for you, as well as select the best vaccine for your situation. These include having an allergy to eggs. Additionally, if you've ever had Guillain-Barré syndrome, or GBS, which is a very rare but severe paralyzing illness. Some people with a history of GBS should not get a flu vaccine. Also, if you're not feeling well, you should talk to your doctor about your symptoms. If you have any concerns about flu vaccination, always be sure to check with your healthcare provider. Thank you for that question. Now let's take a last question. When do I know for sure that I'm coming down with the flu? Or what symptoms should I look for? Flu can have similar symptoms to other respiratory infections like the common cold. However, flu symptoms usually come on more suddenly. When you become sick with flu, you may start feeling feverish, or you can have a cough or a sore throat or a runny nose. Some people also experience muscle aches or body aches and fatigue. If you do begin to experience these symptoms, contact your healthcare provider right away. Flu antiviral medications can be used to treat flu infection, but are most effective when started within 2 days of symptoms. If you are experiencing severe symptoms that might be from flu, such as difficulty breathing or seizures, you should seek medical care immediately. So that's all the time that we have for today. Thank you to our audience for joining us for this special education program. We are pleased to have been able to answer so many of your thoughtful and important questions. And please remember to complete questions at the end of the program to help reinforce some of the topics that we covered today. Additional resources can be found at cdc.gov/flu. My name is Dr. Mark Tenforty. Thank you for joining us.